Hi, I'm Dr. Juan du Plessis from Scoliosis. Today we're going to discuss scoliosis progression, what it means, why it happens, and what can be done to slow it down. When we talk about scoliosis progressing, we're referring to the spinal curve increasing over time. This change can gradually occur, or it can accelerate during certain periods, such as growth spurts, or later in life with age-related challenges. Understanding why a curve might worsen helps guide decisions about when to take action and which type of care may be most appropriate. Scoliosis is a three-dimensional condition. It influences how the spine curves, rotates, and maintains balance. Because of this complexity, even small imbalances can gradually increase if they aren't addressed. In adolescence, the main driver of progression is growth. As the spine lengthens, an existing curve has the potential to magnify. The size of the curve also matters. The larger the curve and the more growth remaining, the higher the risk that it will continue to progress. In adults, progression usually occurs for different reasons. Degenerative changes, things like disc thinning, joint wear, and reduced muscular support can alter alignment and cause curves to worsen over time. Without appropriate care, curves in both adolescents and adults can become more noticeable, more symptomatic, and more challenging to manage as time goes on. Some individuals have a higher likelihood of seeing their curve worsen. Children and teenagers who are still growing are at the highest risk because the spine is changing rapidly during these years. The period before a girl's first menstrual cycle, for example, is associated with a particularly high rate of progression because it often precedes a fast growth spurt. Curve size also plays a role. Larger curves, those above 30 degrees, are more likely to progress, although smaller curves can still worsen when significant growth remains. Skeletal maturity is another factor. The less mature the spine, the more room there is for change. Curve pattern also influences risk. Certain curve types, especially those present in the lumbar and thoracolumbar spine, may be more prone to long-term progression. Identifying all of these risk factors early helps clinicians create a proactive and individualized plan for each patient. The second window is later in adulthood. Degenerative scoliosis progresses as discs lose height, joints become worn, muscles weaken, and posture gradually shifts. Staying active, maintaining strength, and receiving appropriate support may help slow these age-related changes and preserve comfort and mobility. The good news is that modern scoliosis care offers several effective tools to slow or even stop progression. For growing adolescents, 3D corrective bracing such as the ScoliBrace can provide targeted support during the years when the curve is most vulnerable to worsening. Scoliosis-specific exercise programs such as ScoliBalance train the muscles to work more efficiently and help create better spinal control and stability. Regular monitoring is also essential. By tracking the curve over time, clinicians can detect subtle changes early and adjust care as needed. With timely action, many patients are able to maintain stability and in many cases avoid the need for surgery altogether. When scoliosis isn't monitored or treated, curves can continue to worsen. This may lead to changes in posture, muscle fatigue, back pain, and reduced flexibility. In more severe cases, large curves can begin to affect breathing or overall comfort. This is why consistent assessment and ongoing review are so important, even for mild curves that may appear stable at first glance. Scoliosis progression is not random. It follows patterns we understand, and with the right care, these patterns can be influenced. By recognizing the risk factors and taking action during the most important time windows, patients can protect their spine and maintain long-term function. At Scoliosis, our approach is centered on timing and recommending the most appropriate care. We help patients to try and stay ahead of progression and move forward with confidence.